Here's a breakdown of your daily CARs routine. I'm Jade Hayes with Ethos. Let's move. Disclaimer, there might be some places of pinching or pain that you find in your body when you're doing your CARs routine. That's okay. You have found a place in your body that needs more attention, and we'll get to that in future videos. Today I want you to focus on carving out the ranges of pain. So for example, in your shoulder CAR, if you feel a pinch here, you're going to go around that pain and continue in the controlled articular rotation. Starting from the top with our neck, you're going to make sure that both feet are facing forward and they are hip width apart. You're going to drop your chin toward that soft spot right at the center of the two collarbones and make sure that your head does not fall forward off of the shoulder shelf. Pretend that there's a wall behind you that you want to pull the back of your neck into, making the sexiest double chin possible. From here, you're going to feel a stretch at the back of the neck. Once you've hit that range, you're going to rotate to your right as far as you can, making sure that the left shoulder and the left hip don't tag along for the ride. Stay here, but I'm going to turn so you can see what it looks like from the other angle. You're going to drop your right ear into the right back pocket and send that left jawbone up toward the ceiling. Make sure your back does not arch when you do this. If you find that your lower back is compensating in these movements, a simple exhale and an engagement of your core will ensure that you maintain stability here. As you drive the chin up, we're going to pretend that there's a marker at the base of our chin and create this big circle. As you look up, it helps to press the tongue to the roof of the mouth or even jut the jaw up to increase the stretch that you'll feel at the front of the neck. Now we complete the other side by dropping the left ear into the left back pocket, turning to the left as much as you can. Again, make sure you don't rotate your whole body or the right shoulder doesn't move forward. Drop the chin to the base of the collarbone. Remember that wall behind you as you tuck your chin and find center. We'll go through one more round. Drop the chin, lift the back of the hairline up toward the ceiling. You're going to turn to your left. Don't let that right shoulder tag along. Drop the left ear into the left back pocket as you jut the right side of the jaw up. Exhale your ribs down. That's a common compensation here. Pretend there's a marker at the base of the chin. Draw a big circle up at the ceiling, looking over to your right. Right ear drops into that right back pocket. Look over the right shoulder. Drop the chin to the collarbone and come back to center. Moving on to thoracic CARs, we want to isolate just the upper spine, so we're trying to maintain as much stiffness or stability in the lower spine as possible. Cross both hands over the chest, and as you round through just the upper back, make sure the lower back doesn't come along for the ride. Rounding through flexion, we're then going to rotate to the right. Make sure your left hip doesn't tag along. Pull the right shoulder into the right back pocket. Think about counterbalancing the extension that we're about to do here by tucking your tailbone so that the extension just comes into the upper spine. As you rotate the chest up to the ceiling, imagine pulling the sternum up to a 45-degree angle where the wall and the ceiling meet. Drop the left shoulder into the left back pocket, rotate to the left. Again, don't let that right hip tag along. Side bend to the left as much as you can, and then round forward back into flexion. One more time all the way through. Rounding into upper thoracic flexion, then we side bend to the left. Rotate to the left as far as you can, keeping your hips stable. Drop the left shoulder into the left back pocket, driving your sternum up toward the ceiling, keeping your lower abs tight for spinal stability. Right shoulder pulls into the right back pocket, rotate to the right as far as you can. Side bend to the right, and then round back to center and come back into neutral. So one more time, fluidly moving through our thoracic CARs, you're going to start with the hands across the chest. Round through the upper back, making sure that the lower back stays neutral. You're going to side bend to the right, rotate to the right, drop the right shoulder into the right back pocket, tuck the tailbone to counterbalance the thoracic extension as you drive the sternum up toward the ceiling, rolling that left shoulder into the left back pocket, rotating to the left, side bending to the left, and then rounding forward, coming back to standing. Moving on to our scapular CARs, here are two variations that I'll show you today. For the first one, we're going to start by making two fists and bringing them right to the sides of the hips. There's a point to this, I promise. We're going to first start in scapular elevation, where we're pulling the shoulders up toward the ears. And then as you squeeze back, you're going to feel the upper traps activating. Think about squeezing the very tops of the scaps together. You're going to feel your upper traps activate. Now, make sure your elbows do not bend. So the fists by your thighs, I want you to reach them down toward your heels and try to keep your elbows straight the whole time. Now, as you drive down into scapular depression, you're gonna think about squeezing the middle of the scaps together. And then as you reach your hands to your heels as hard as you can, think about squeezing the bottom tips of the scaps together. Imagine that there were a pencil placed right at the spine. I want you to try to squeeze that pencil as much as you can, and then lengthen the back of the neck to get a little bit more of a stretch. Driving your scaps all the way into depression, reaching your hands to your heels as much as possible. Pulling forward. Now here's where the hands need to stay glued to the thighs. Very often people cheat and compensate by moving their hands forward. I want them to stay in constant connection. As you drive the scaps forward, we're trying to get into protraction. Now I don't want you to lean forward either. Think about lengthening the crown of the head up toward the ceiling. Pulling the shoulders back up and around. We're going to complete one circle. Again, straight elbows, hands glued to the thighs. And then reverse it. Pull your fists down toward your ankles. Squeeze the bottom tips of the scaps together. Middle of the scaps together. Upper scaps together. Drive the shoulders up to the ears, but don't let the elbows bend. Round the shoulders forward, but don't let the hands move forward from the thighs. And then continue. Now for your shoulder CARs, you want to start by turning the palm of the hand forward. Adduct across the body. You're trying to squeeze as much as you can. There's a common tendency to turn here, so make sure your sternum is facing straight forward. Now, as you squeeze the arm across the body, you're going to move into shoulder flexion. This is very common to throw the ribs forward and to arch the back. Exhale, stacking ribs over hips, and only move as far back as you can. You ideally want to get the arm in line with or behind the bicep, but if you can't today, that's totally fine. Just hang out here and then continue the range. Once you find your max shoulder flexion, you're going to then internally rotate, turning the thumb forward and the palm away. A common compensation in shoulder flexion is to thrust the ribs forward and to arch the back. You can exhale, keeping the ribs stacked over the hips and the lower abs engaged. And if you can't go as far back as I can, that's totally fine. That's why you're here practicing with me, right? The goal eventually one day is to get the arm in line with the bicep. Now we're going to internally rotate, turning the thumb forward and the palm away. As you rotate the arm back behind you, do not let the shoulder roll forward. So think about pulling your scapula down toward your hip and find as much internal rotation as you have. Again, that's what we're trying to avoid right there. This is often something that is missing in people's CARs. They will go into the internal rotation here and they end up with the inside of the hand or the palm of the hand against their thigh. That is not the goal. As you move through your full internal rotation, you want to end up with the back of the hand against the side of the thigh. So that means the arm bone is fully internally rotated. Another cheat is to bring your hand at the front of the shoulder to make sure we don't round it forward. Now reversing the CAR, we're going to move the shoulder back into extension. External rotation, the palm turns out and the thumb turns up. Don't let your body turn here. Moving all the way around through your greatest range of motion without spinal compensation, you're coming all the way around back to that starting point. We'll go through this one more time. Start by turning the palm of the hand forward, the thumb is out. Adduct across the body. We're squeezing as much as we can. You're going to feel the tightening in the chest. As you flex the shoulder, you're trying to get the shoulder in line with the ear without cheating in the spine. Internally rotating, your thumb will roll forward and the palm faces back. Here's the point where you can put your hand on the shoulder to make sure that you're not cheating. You're squeezing your scap across the back. Internally rotate as you go all the way down. Once you finish, the back of your hand should face the side of the thigh. Extend through the shoulder. Externally rotate as much as you can. Make sure you're not turning. Then bring the arm all the way up and around, squeezing across the body and finishing where we began. One more time, starting with the palm of the hand facing forward. You're going to squeeze the arm across the body. Pull the bicep toward the ear. Turn the thumb forward and the palm out. As you bring the arm all the way back and around, continue to rotate until the back of the hand hits the side of the thigh. Bring the arm back behind you. Externally rotate, squeezing the scap toward the spine. Bringing it all the way up and around. Squeeze across the body and you'll finish where we started. For the elbow, we're going to bend the elbow, squeezing the elbow to the ribs. A common compensation is to wing the elbow out to the side, so make sure you don't do that. One thing I like to do for my clients is grab a tennis ball and place it right to the inside of the elbow. They can't drop it. Now, as you squeeze the tennis ball into your ribs, you're going to turn your palm up to face the ceiling. This is called supination. Think about holding a soup bowl in your hand, supination. As you supinate, as much as you can, you're really trying to get the pinky to drive up to the ceiling and the thumb to drive down. You're going to squeeze the hand toward the bicep as much as you possibly can, and then pronate, turning the palm away, and then you drive the hand all the way down. Pronation, ideally, you want to be able to get your pinky in line with that first finger. So here's what most people look like. Over time, you want to try to be able to pronate through the elbow with full range of motion. And then you continue by extending the arm all the way, continuing to try to rotate at the elbow, pulling the hand back up toward the bicep, moving back into supination as far as you can, and repeat. For your wrists, you can make a fist or you can have a straight hand. Both are valuable. I'll do a straight hand today, but play with variability. Keep the elbow pinned to the ribs, and you're going to extend at the wrist as much as possible. Now we're going to rotate the pinky in, keeping your fingers straight. That's the hard part here. We're going to move into wrist flexion. Ideally, you want to try to hit as close to 90 degrees as you can. Driving the thumb out, you're going to go back all the way to the starting point. Reversing that circle, drive your thumb to the side, flex at the wrist, pulling the fingers back toward the forearm as much as you can. Don't let the elbow bend. Rotate the pinky toward the midline of the body and move back into extension. Now for your hips, you might want to hold on to something. I don't want balance to be a factor here. You're going to start by grounding through one foot and pulling the opposite knee into the chest. Making sure that you do not round the lower back or bend the knee when you do this. You're only going to pull into hip flexion as much as the rest of the body stays perfectly still. Now, we're going to externally rotate at the hip. Think about pulling your ankle up toward the ceiling and squeezing it across the body. Moving back into hip flexion, then into hip abduction. You're going to drive the knee out to the side, but don't let that hip tag along for the ride. As you drive your knee out, you're going to rotate the heel up toward the back of the head. Yes, your knee is going to drop, but I want you to fight the drop, meaning you're trying to keep it as high as you can as you swivel the foot up toward the ceiling. So abduction, internally rotate. Now as you kick back behind you, your back is going to want to arch. That's when we use our lower abs to pull the ribs up or to think about tucking the tailbone. Kick back as much as you can as you maintain stability. Externally rotate, bringing the ankle to the back of the opposite knee. Pull the knee in toward the armpit. Squeeze it back around the body, finishing how we started in external rotation. One more time all the way through. Pull the knee into the chest. Remember to hold your stability at your spine. Externally rotate. Pull the ankle up toward the ceiling. Driving the knee in and then back behind you. Remember, you're only going to push the knee as far back as the hip doesn't tag along. Internally rotate, driving the heel up toward the ceiling, but try not to let the knee drop. As you internally rotate, you're going to kick back behind you. Think about tucking your tailbone. Externally rotate, knee up toward the armpit. Squeeze it across the body, finishing an external rotation. Start by standing on one leg. You're going to pull your knee into your chest. Externally rotate, pulling the ankle up toward the ceiling. Drive the knee out to the side. Internally rotate, driving the ankle up toward the ceiling and keeping the knee as high as you can. As you kick back, you're trying to tuck your tailbone. Externally rotate, bringing the ankle to the back of the knee. Pull the knee in toward that armpit and then back across the body, finishing how we started in external rotation. For your knee CARs, you are going to have a seat unless you're a ninja and can do this standing. I want you to think about the tibia and how it spins. Imagine there is a cast at the ankle, so we want as little ankle movement as possible. It's the rotation here that we're really chasing. I like to give this variation to my clients because it locks their hip and knee in place. Taking your forearm, putting it underneath the knee, grab the opposite bicep, and then now we have a movement block. Flex at the ankle, and then as you spin, we want to think about the tibia externally rotating. And then as we spin in, medially, we want to think about the tibia internally rotating. So that's the basics, internal and external rotation, and now we add a little knee extension. As you shift back onto your sit bones, you can straighten this leg if you feel too compressed, but we're going to internally rotate and then straighten the leg as much as we do not round the spine. If you feel too compressed here, you can straighten this leg. The whole goal is to maintain as much of a neutral spine as possible. So you can put this leg as straight as you need to get that. As you pull the knee into the chest, you can use this kind of as a cheat. As you drive the leg back and pull the sternum forward, that's automatically going to keep you in the position that you need to be in. As we internally rotate the tibia, we're going to straighten the leg only as much as you do not cheat through the spine. We want to maintain, again, that completely neutral. And then we externally rotate and pull the knee back into knee flexion. Internally rotate, knee extension. Externally rotate, knee flexion. And then we're going to reverse it. So keeping that external rotation, you extend at the knee, internally rotate, and then come back and repeat in each direction. For our ankle CARs, it's very helpful to think about increasing the crease at each part of the ankle as we move through the circle. So starting in dorsiflexion, you want to increase the crease at the top of the ankle. Now, as you rotate to the right, imagine driving your big toe down and pulling your pinky toe up, which increases the crease at the side of the ankle. Now, as you point down with the toe, you're going to increase the crease at the back of the ankle. Leading with the big toe, drive the big toe up, try to point the pinky toe away, which increases the crease at the inside of the ankle, and then you start back at the center. You can do that direction multiple times. We're going to reverse it, leading with the pinky toe. So now, as we drive the pinky toe away, you're going to pull the big toe up. Pointing the foot as much as you can, lead with that pinky toe. As you pull the pinky toe toward you, you're trying to drive the big toe away and then pull all the way back to center. You might catch some cramps in the toes. That's totally fine. That means that your foot needs a little bit more tension and that your brain is having a hard time engaging those deep intrinsic foot muscles. This is going to be very, very beneficial for your gait pattern and the function of your feet. Now that you've been through the full basic CARs routine, you have an idea of what parts of your body need more attention. If you felt cramping when you moved into certain ranges of motion, it means there's a neuromuscular confusion there. Your brain does not quite know how to use those muscles in that range. Spend more time there. If you found a pinch or a pain in one of your ranges of motion, that's a sign that you need more help there. So maybe doing CARs on a regular basis can clear it up, but oftentimes you need a little more. The purpose of CARs is to find out what range of motion you currently own and then to keep it and to nourish your joints on a daily basis. So if you find you have trouble spots in your body, just focus on those CARs more. And the most important thing is to train smart, work hard, and live well.